In our last video, we described the signs and symptoms of a concussion, and we learned that you may not always be able to tell if you've had a concussion. So, what do you do next if you think you might be concussed? What are your tests and what are your options? If you suspect you might have a concussion, what you do right afterwards is critical to recovery. If you've hit your head and you have any kind of bleeding or loss of consciousness, seek medical attention immediately. Now, with a serious or a moderate head injury, the symptoms are typically obvious and immediate, symptoms like nausea and dizziness or confusion or loss of consciousness. The doctor will perform a physical exam to check your nervous system, that is, your brain and your spinal cord. The doctor will look for changes in your pupil size, in your coordination, and in your reflexes. In some cases, the doctor may ask for a CAT scan or an MRI to check the extent of the damage that occurred to both the skull and the brain. One of the biggest concerns here is that there may be a bleed in or around your brain, because when you move the brain, that can shear blood vessels, and then you get blood building up and compressing the brain, and that's a medical emergency. Often, when someone has a bleed, they have increasing drowsiness and confusion. That's why it's critical to monitor anyone who's hit their head. Now, let's imagine you don't have a bleed, which is true for the majority of cases in which someone gets a mild traumatic brain injury or concussion. In this case, nothing is obvious on a brain scan, and from there, a concussion is diagnosed by the symptoms. This is the current standard for diagnosing concussion. But there are three main challenges here. The first is that symptoms don't always appear right after the impact occurs, so concussion is sometimes overlooked this way. The second challenge is that individual concussions are different. Two people may have very different symptoms. One might have little change and another might have real cognitive impairment. And the third is that even for an individual, a first concussion might show up differently from a second concussion. Increasingly, neurocognitive testing is used as an objective measure. When a person becomes concussed, there are subtle aspects of cognitive function that become impaired, such as memory or attention, or impulse control or visual perception. Using interactive tests on a tablet or a computer, healthcare professionals can detect these very small changes in cognitive health, changes that otherwise might not be detectable. There are other tests being developed with the hope of better quantifying concussion. These include electroencephalography, or EEG, which measures brain waves, and also blood biomarkers, which are proteins that you can detect in the bloodstream, and these indicate brain tissue injury. Those are still being researched, but they may play a role in the diagnostic portfolio in the future. Now, identifying a concussion early is critical to the recovery plan and to preventing further injury. And that's because these smaller impacts that don't seem too bad, these can then get neglected. And if you have a mild brain injury and you return to work or the playing field too soon, that can increase your chances of more damage and slower recovery. So consult your doctor for the best course of action. In the next videos, we'll tell you about the path to recovery.